You're watching Let's Chat.
All month long during February, we are celebrating National Heart Month. And from the Chattanooga Heart Institute, we have Dr. Bill Warren here. Dr. Warren is a cardiologist. First of all, thanks so much for joining us.
Thanks for having me.
Break it down for those of us who aren't super well versed in medical terminology. Are you more of the heart plumber or are you more of the heart electrician?
So, the Heart Institute has everything you need through a cardiologist.
Sure.
I'm mainly a non-invasive cardiologist, so
Right.
I'm into prevention, I'm into outpatient treatment and imaging.
The human heart, when you think about it, there's nothing else like it. It's about the size of your fist. It pumps, 2,000 gallons of blood throughout your body over the course of a day. And that covers 60,000 miles of veins. It is tremendously complicated. When you're getting into a heart case, what is the first thing that you look for?
Well, I think you always pay attention to the patient, see how they're doing, what's their blood pressure, their vital signs. And, nowadays cardiac care is so complicated, then you sort of focus on the procedure and what you're there to do.
Seems like more and more the list of available blood pressure medications keeps growing and changing. Why is that?
Well, I think there's new ways to target blood pressure with the control of blood pressure is so complicated. We think of it, maybe it's just a heart-related thing, but it's related to the kidneys, to your blood vessels, to the adrenal glands. And so there are now medications that target each of those control points of your blood pressure to try to help doctors be able to manage that better for patients.
If you're on blood pressure medication, is it better to take it early in the morning or late at night?
In general, we now know it's best to take it later at night, like when you're going to bed. This is different than advice we gave patients even 5 years ago, but there have been some big studies that have shown better outcomes if you take blood pressure medications at nighttime.
Why is that?
Well, we think it has to do with what we call the cortisol surge. This is like a stress hormone surge that happens in the early morning. It's really the reason that you often wake up before your alarm in the morning because your body is telling you it's time to get up. Those signals are really stress hormones, and that's the most common time for a patient to have a heart attack. And if you have medications from last night on board, then they're more protective than if they're wearing off from the previous morning.
Overall, when it comes to to heart attack related deaths here in the United States, that number is down, but you were telling me during the break that the number of other heart-related illnesses is rising. What are those illnesses and what's the cause?
Yeah, this is that classic good news, bad news story, Chip, where the good news is deaths from heart attacks has declined significantly over the last 50 years, probably due to significantly decreased smoking, better medications for cholesterol. All the new technologies that we rely on now have been invented since the 1970s. The bad news, though, is other heart-related deaths are on the rise. And these are deaths related to congestive heart failure and especially high blood pressure-related heart deaths.
Congestive heart failure is a buildup of fluid around the heart, correct? What do we do to minimize that?
Yeah, it's a little complicated these days. We think about congestive heart failure now in two ways. The most logical way is if your heart is weak and not pumping well, then fluid builds up, as you say. We treat that with diuretics to get fluid off, certain medications targeted to try to improve the heart function. But what's growing is a different type of congestive heart failure. This is not weak heart muscle congestive heart failure, but it's when your heart is stiff. And this is the problem that's contributed to by high blood pressure and diabetes. And if your heart is stiff and can't relax and fill up with blood, then you can have a buildup of fluid for a different reason.
And you're also seeing a large increase in the number of just stress-related heart attacks.
Yep, this is true. I mean, there's a new recognition of something we call a stress cardiomyopathy, or as you're saying, a true stress-related heart attack, which, our mothers always told us this sort of thing, don't get stressed out, you might, have a heart attack from this, but we do now know that that is a legitimate thing.
All right, true or false for you, Dr. Bill Warren, do you play Led Zeppelin in the operating room?
I do not.
I'm just kidding.
That's where the bow tie comes from.
You have been a wealth of knowledge here, and we certainly appreciate you coming down. Please join us anytime. You can get in touch with Dr. Warren and the great staff at the Chattanooga Heart Institute. You can find them online, and the website, ChattanoogaHeart.com, ChattanoogaHeart.com.